Hello, everyone, and thank you for joining us today. I would like to start with informing you that this webinar is being recorded and to please keep your mics turned off until we invite you for the Q&A session at the end. Again, welcome everyone. I'm Rashi Chauhan, the Communications and Fundraising Manager at WWP EN, and your host for today's webinar on guidelines for perpetrator programs focused on LGBT plus communities. Today, I will be having a conversation with the esteemed Professor Catherine Donovan on the subject. Recently, Catherine wrote an expert paper on LGBT plus perpetrators, visibility, recognition, and interventions for us at WWPEN. All right. Yes, recently, Catherine wrote an expert paper on LGBT plus perpetrators, visibility, recognition, and interventions for WWPEN. She was also a part of our annual conference in Berlin in October, where she gave a keynote speech on domestic abuse in the relationships of LGBT plus people, a focus on perpetrators. Let me give you a brief introduction about her. Catherine Donovan is a professor of sociology and head of sociology department at Durham University. She has researched the intimate and family lives of lesbians, gay men, bisexual women, and more recently, trans plus folk over 20 years. For most of the time, her focus has been on their victimization through and perpetration of domestic abuse, including sexual violence. She conducted the first study anywhere comparing love and violence in heterosexual and same sex relationships with Professor Marianne Hester, and the first study focusing on the use of violence and abuse by LGB and or trans plus people with Dr. Rebecca Barnes. Hello, Catherine. Thank you so much for joining us.
Absolute pleasure. Thank you very much for inviting me. And
All
hello,
right.
everybody.
All right, then. So let me straight away begin with our interview session and webinar. My first question for you, Catherine, is could you provide some context on why it's essential for domestic abuse programs to specifically address the needs of LGBT plus community?
Yeah. So I suppose what's important is that we know, and we know this from the kind of victim survivor data more than from the perpetrator data, that LGBT people are being victimized by domestic violence. So if they're being victimized, we need to be finding ways to address the perpetration and the abusive behaviors and the harmful behaviors of their partners. So there's very definitely a need there for interventions. I think the interventions need to be able to specifically address LGBT people's needs is because the existing interventions are rightly based on what we know about how domestic abuse takes place in cis heterosexual relationships. So that kind of account is that numerically it is cis heterosexual men who are abusive towards their cis heterosexual women partners. So there's an assumption of heterosexuality. So we might come back to that. There's an assumption that these are cis heterosexual relationships. And what we've learned, and feminism has been really instrumental in this, is understanding that those abusive relationships don't just take place in isolation, they take place in a society that is patriarchal. And there are many things about patriarchal societies that collude with abusive cis heterosexual men's behaviours because patriarchy positions women structurally as subordinate to men. If you look at employment or wages, or in the political sphere, in the family, in faith institutions. So there is a real kind of systemic way that cis heterosexual women are positioned subordinately to men. And that is really important in understanding the ways in which cis heteronormative gender norms and roles can be drawn on and used by abusive men in their relationships with women. But that isn't the same for people who are LGBTQ. Yes, we all live in a patriarchal society, and gender and heteronormative gender norms are still very important for understanding how people behave in their relationships when they're LGBTQ. So I'm not saying that gender isn't important, but the context is different. So we live in societies that are not only patriarchal, but they have also systematically positioned LGBT people as subordinates. So historically, we've been seen as criminal, we've been seen as pathologized. There's something wrong with us, genetically or chemically or hormonally, and also that we have been morally suspect, that we are somehow deviant in ways that threaten the things that society holds dear, such as the family and security, national security, and particularly in relation to children. So that context is a really different context for LGBT people, and also provides some of the tropes that abusive partners can draw on to abuse um, their partners in those relationships. So we need to understand what those tropes are to help us ask the right questions about what is happening to people, and to make sense of their behaviors, particularly in relation to help seeking, but also in order to develop interventions that address the particular ways that LGBT people can cause harm in their relationships, in their intimate relationships.
Thank you. Thank you. That very nicely leads me to my next question for you, Catherine. How does structural discrimination shape the experiences of domestic abuse for LGBT plus individuals? And with that, can you maybe discuss the specific forms of identity abuse prevalent within these communities?
Yeah. I mean, it's important to say that there's a lot of similarities across sexuality and gender. So it's about power and control. It's about regulating or punishing a partner for not conforming to what we call the relationship rules. So abusive partners um, kind of construct relationship rules. And the two simple ones are one, that the relationship is for them, everything is about them, they set the terms for the relationship. Um, and the second rule is that the victim survivor is responsible for everything. They're responsible for the abuse, they're responsible for the abusive partner, they're responsible for the relationship, they're responsible for the house or the home if they share one, they're responsible for children if they've got them. So there are real similarities across, but but that specific context is different. And one of the ways that we can call it this is to look at identity abuse. But identity abuse is informed by structural abuses of LGBT communities. So we can see it in terms of undermining people's identities, undermining or threatening people's presentation of self. We can see it in how people are undermined in terms of their relationship practices. So, to give you some examples, you might get this can happen with experiential power. So, an abusive partner who's been out for longer, has more experience, more confidence of being out, can undermine or make fun of or put their victim survivor on the back foot around whether they are being authentically gay. You're not gay enough if you don't do these things, if you don't agree with these kinds of things, if you won't go along with these kinds of behaviors that might be to do with what you look like, you know, your presentation of self, your hairstyle, whether you're tattooed or not, whether you look the part in the abusive partner's eye as an authentically gay man or bisexual woman or trans woman. So there's that kind of abuses, because there have been stereotypes about what LGBT people look like or how they might behave. There's also abuses that can come that are to do with your identity. So whether you're out or not. And if you live in a society where it is still difficult to come out to your family of origin or to your place of work or in school, then an abusive partner can use that to threaten you with outing you to your family of origin, to your faith community, to your friendship networks. To threaten somebody to out them wouldn't work if it didn't matter if you came out. If you live in a society where it does matter if you come out, then that's going to be quite an effective um, threat to somebody to control them. So you can also have people where abusive partners will use tropes about sexuality, because LGB people, I suppose, have been defined. We've been defined through sex. So gay men want sex all the time, can have sex without emotions, have casual sex, want open relationships. And of course, some gay men do want that, but that can also be used as a way of regulating or threatening or undermining a partner who wants to have a monogamous relationship or who doesn't want to take part in chemsex parties or who doesn't want to have an open relationship. So those tropes can be used. Well, you're not gay enough. What's wrong with you? Why can't you do this? This is what everybody else does. This is how gay men behave. So you can have those kinds of identity abuses that are related to relationship practice that are to do with assumptions and stereotypes about sexuality. Bisexual women appear disproportionately in the research as being victimized with sexual violence. Now, why is that? But we know that there are tropes about bisexual people being greedy, untrustworthy. They can't make their minds up. So you can't trust them. If they're with you, they'll be looking for somebody else. They'll be looking for somebody of a different gender if they're with you and you're of this particular gender. So, or that you're hypersexual because you're bisexual or pansexual. So you want sex all the time. Those kinds women or two men might be equal. So anything that's happening in that relationship, while you wouldn't excuse it, because if there's violence happening, then violence is never acceptable, it's quite, you might imagine that it's not, that somehow it's a fair fight. Or that if it's two women, because women aren't, I'm going to put this in inverted commas, naturally violent. I don't agree with that, but we might, that you can see how those assumptions can be made, that women aren't socialized into being violent, that anything that they do to each other is not going to be of grave concern. It's never going to be as risky or as harmful as the violence that a man can perpetrate against a woman. And men, you might say, yes, if it's two men, yes, they could be violent towards each other, but they probably, because they are either naturally or socially familiar with violence and aggression, that they can defend themselves. So again, it's more likely to be a fair fight than the violence that a man can do towards a woman. So I think that those assumptions that we all carry because we're all part of the same society can get in the way of always identifying when something is domestic abuse, and also when you're being asked to consider who the abusive partner might be and who the victim survivor might be. I think the other reason that people are less visible is what I've kind of intimated before, which is a gap of trust between LGBT communities and help providers. I think there is a sense in which, the domestic abuse field is seen as a source of help for cis heterosexual women. And so gay men, bisexual men, where is the obvious place for them to go? There isn't an obvious place. There are a couple now of bi and for organisations set up in Britain. I don't know what it will be like where you are, but in Britain, there's nowhere in the northeast where I live, the northeast of England. So they're mostly around the southeast of England, around London, and around there's nothing in Wales. So there aren't obvious places for people to go. So, when Rebecca Barnes and myself did the research, this is a while ago now, but I don't see any change substantively. We wanted to look at people who have been abusive. Well, if you're doing that in heterosexual domestic abuse, you go to the mandatory perpetrator programs or the voluntary perpetrator programs, and you can recruit from there. I'm not saying it's easy, but you've got a way in to connecting with people who might take part in your research, who might be abusive people. But if you're trying to do that with LGBT people, that doesn't exist. There aren't any mandatory programs for them. There aren't any voluntary programs for them. There are now beginning to be some one-to-one interventions where practitioners have developed skills, and they don't want to turn people away if people are coming forward. So they're really working hard to try and address those needs in those abusive people. But there isn't any evidence base for it that can be drawn on, other than what we know about with heterosexual people. So, and again, as I say, there are some similarities, so there's some usefulness there, but this kind of contextual stuff, that you're not talking about heterosexual people, you're talking about people who have been othered in their sexuality or their gender identity, and that has an impact on how they live their lives and how they run their relationships. So yeah, I think those are the two main barriers, the public story and the gap of trust.
Thank you, Catherine. Yes, as you say, there are a lot of misconceptions and misinterpretations that currently exist that we need to uh, kind of get rid of and put actual processes that are catering to the community and understand what's happening to the community for them to be able to fill in the gap and actually avail the services that they require. It's a lot of work. And with that, I would like to move to the next question, which is also to shed light on something that is not probably talked about much so far in amongst practitioners. Can you elaborate on the misconception of mutual abuse in LGBT plus relationships? And how should practitioners distinguish between genuine mutual conflict and a space for reaction by the victim?
Yeah, this is a hard one, I think, because there's quite a bit of research coming from North America that quantitative research, we could have a whole session on the limitations of this, but nevertheless, it's done with in good faith, but that shows that mutual abuse, or they call it bidirectional violence, is very prevalent in the relationships of LGBT people. I'm not convinced by that, and it's something that Rebecca and I looked at in our work, and we didn't find evidence of that in the survey that we conducted. But I again, I think that there's methodological issues there, which I won't go into, but I will talk about what I think practitioners could start to think about doing, which is just being aware that what I was just saying about the public story operates. That you might think that two women together, um, if they're both reporting that they've each used violence or abusive behaviors, that you can just read it as they give it, and if that's what they're describing, then that equals mutual abuse, and that kind of fits with the idea that two women, it's more equal than an unequal heterosexual relationship. So it kind of fits with that idea. But I think if we can go back to kind of feminist principles of what is abuse about, then it's about power, and it's about the abuse of power. So I would suggest following the power and following who's taking responsibility are two ways into having a different kind of conversation with people. Because what we did in the first project that I did with Marianne Hester was that we were trying to find ways to make sense. So we compared love and violence in heterosexual and what we called then same-sex relationships. And we were trying to find ways of looking for similarities and differences in how people talked about what we called their worst relationship. And almost all of their worst relationships were domestically abusive, even if they didn't initially realize that at the time. So what we've found was a way of talking, which was that regardless of gender or sexuality, there were these two relationship rules where the abusive partner is able to set the terms for the relationship and is willing to use violent and abusive behaviors to establish and maintain those rules. So it's all about them, it's their terms, and the terms will be different in different relationships. But if you can find out who the key decision maker is, that will tell you something about how power is operating. And obviously, the other feminist principle with thinking about domestic abuse is not to look at incidents as discrete and separate, but to look at the relationship, look at it holistically, and to understand how power is operating over time, so that you can get a sense of what are the impacts of these behaviors on people, and also a sense of what the motives are, for the underlying motives for the behaviors that are being used. So that's the first relationship rule. It's all about me. This relationship is about me. And then the second one is victim survivor, you have to do everything. You have to take responsibility for everything. So that is about, people being very, victim blaming. So they blame themselves because they've been told, if you didn't do that, or if you did do that, I wouldn't have to hurt you. I wouldn't have to lose my temper. I wouldn't have to behave the way I do. We know that abusive partners are very good at laying the blame for their behavior at the survivor's door. So, working out, asking questions about responsibility, who's responsible for stuff in the relationship, can also give you a sense of how the power is operating. And very often, people who are being victimized will own up, in inverted commas, to the things that they have done, um, and be quite honest about what they've done. Whereas we know that people who are abusive will minimize what they've done and look to locate the blame elsewhere. It's never their fault, it's always somebody else's fault. So, thinking about those kinds of dynamics, I think, can help to unpack how a relationship is, how the relationship rules are operating in that relationship. I'm just checking my notes to make sure that I'm including things that I wanted to include here. So that when I think people will say, and we interviewed people who said, I was as bad as them, or um, oh, it was 6 of one and half a dozen of the other. I don't know if where people are speaking from, so I don't know if that that will make sense. But basically, it was about both of us. But when you actually asked about the relationship, you could see that there was a whole set of dynamics that are in place that position the perpetrator, the abusive partner, as being in power and control, and the victim survivors' use of they might have pushed back, they might have shoved, they might have screamed, they might have done all kinds of things, got into a physical fight, but the motives are not power and control. The motives are self-defense, retaliation, um, frustration. We know that people use violence for different reasons. And that's another, Michael Johnson's work on helping us think through the different reasons that people have for using the violence. And thinking about that can also help us understand and unpick what is going on and where that's what we call space for reaction. So they're not abusive partners. They are using violence or what we might call, put in inverted commas, abusive behaviors. They're screaming back, they're using verbal abuse or aggression. But they are creating space to try and re-establish some equality or some equilibrium of power in the relationship. It doesn't work because that's not how abusive relationships work. But it's useful for the abusive partner because they can then also say, well, you're as bad as me. Who's going to believe you? Why are you going to, there's no point reporting because they're not going to, I'll just report you. And they do, you know, abusive partners are quite happy to ring the police or to report a survivor. So that can become very, very difficult for survivors who are then identified as perpetrators in the eyes of the police. So yes, if you're working with people, I would, and in the paper we've got a power and control wheel that's got the space of reaction, and space of reaction can also include when people start to think, I need to leave. That's also potential space for reaction. Taking stock, taking a review, thinking through who could I speak to, and we know help seeking is a process. It's not a one-off thing. Um, but that might also make them realize that things are very seriously wrong and might enable them to feel that they need to fight back, that they need to protect themselves or their property or their children from the abusive behaviors that are going on. But that doesn't make them the abusive partner.
Thank you for that, Catherine. Uh, while we are on the subject, I would also like to ask you how important is it for practitioners to understand the intersections of various identities such as race, citizenship, and socioeconomic status while working with the LGBT plus perpetrators as well as victim survivors?
Well, it's important with everybody, isn't it? Not just with LGBT people. It's really important with everybody that you come into contact with because um, all those people don't come into their relationships a blank sheet. They come in with everything that has made them who they are, their experiences of their families of origin, their experiences of being brought up in a faith community, their experiences of being part of a racially minoritized community, their experiences of being part of impoverished or working class communities. And all of those things shape um, what people think about what kinds of behaviors are acceptable in a relationship, what kinds of behavior, where's your limit to acceptability in a relationship. It'll have an influence on, especially if you get married, your ideas about what marriage means. Are you able to divorce? Does that feel like that's an option to you if you're a member of a faith community, say? Um, It'll also impact on where you might seek help. Who do you see as understanding or trustworthy people in your life? How do you view, if you're from a racialized, minoritized community, how do you view the police? Would, would you see them as potentially a help provider, or do you see them as an institution to be frightened of with good reason? So your intersecting identities are really, really profoundly important to understand, so that you can understand how people are making sense of their relationships and making sense of their options about leaving or what to do. And with perpetrators or people who are abusive, it's really important to understand what kinds of justifications they can fall back on for their behavior. Um, and I mean, people who work with perpetrators try to make a distinction, don't they, between understanding that people might be abusive as a result of um, particular experiences that they might have had, but that you make a distinction between understanding and excusing. But of course, abusive people typically like to have excuses for their behavior because it's never their fault. It's always somebody else's or some other external reason for their behavior. So understanding where they're coming from in terms of their intersecting identities is really important. And for LGBT people, there's that added thing because we know as well that a common experience, again, across gender and sexuality for people who are victimized by domestic abuse is being isolated from family and friends. And in LGBT communities, friends can be more important than family, particularly if you've been rejected by family because of your identities of sexuality or gender. So friendships can become, well, people talk about their chosen family or their family of choice. That is the group of people that might include a couple of members of your family of origin, but will include other people from the LGBT community, some straight friends, and your family of choice is who you rely on rather than your family of origin. But if that is a relatively small group of people, or if you live in an area where there isn't very much of a visible LGBT community, then leaving your relationship can pose real problems of social support. Who is going to be your support network once you leave. And equally, for people who are abusive, we know that abusive people, it's really important that they can, they come to the interventions. But if they're going back into a set of social conditions where actually everybody colludes with them, that's very difficult for them to actually change their behavior, because the messages they're getting from their social support networks is, well, there's nothing wrong with how you behave. That's how you should behave. And again, for LGBT people, if their support network is small, or they don't feel that they can be out to a larger number of people, then that social support network that we know is necessary to support change as well as to support survivors, you need to know about that. You need to know about that because you need to know whether there is anything else that you can offer to put those abusive people, if they're going to try and change their behavior. They're going to need different kinds of support to rebuild social networks that can support non-abusive behaviors.
Thank you, Catherine. This is a very, I'm very well placed to ask this question while we are discussing lack of trust between the community and public institutions. Uh, what role does community engagement play in raising awareness? Quite important, yes. But could you share any best practices for building trust with LGBT plus communities, especially for mainstream organizations that may not yet be well known in these spaces?
Well, number one, it's a long job, and that is really challenging in a situation where funding is very often not long term, um, because it's. I mean, I think I'm involved with a project where we're putting out to tender a project to provide a perpetrator intervention for LGBT people one to one. And we've tried to build into the tender that we would expect there to be a period of time before the project actually starts. The intervention is actually launched with somebody, that is about the successful project working with the local community, with the local LGBT communities, to develop a good relationship with them, to develop maybe even uh, LGBT members that can join the steering group of the project. But it's time. You need to acknowledge that this takes time, because I think many organisations now are very aware that they need to be working with LGBT people, but there are a group of those who believe that if that they serve everybody, and that's what they say in their literature. We serve everybody. It doesn't matter who you are, you can come in and use our service. But if you're an LGBT plus member, what's the proof that that I can come and use you? If you don't use explicit language, if you don't say this includes our local LGBT members of the community, if you don't say it, what's the evidence that you're going to be somebody that I can use, that I'm going to get a good. I mean, we know, don't we, in domestic abuse field, how important that first response is. If somebody has the courage to come forward, whether they're a survivor or a person who's abusive, and they want to do something about it, they've taken the courage to come forward and they don't get a good first response. It's a disaster, isn't it? Because you've lost them, and it might take them many years to do that again, to come forward again. So LGBT people, I think, need evidence that the service is trustworthy, will not be homo bi transphobic, will not minimize, will not compare them to heterosexuals, cis heterosexuals, will not problematize their identity. I mean, we've interviewed people who have come forward and used services. Um, Most of them, the research tells us that most often they go to counselors or therapists. Very rarely are they using domestic abuse services. Very rarely are they reporting to the police, as far as the evidence tells us. But even when they go to those, we've got people who we've interviewed who just say it became really clear that they thought the problem was that I was bisexual, and they wanted to talk about my bisexuality. But I haven't got a problem with my bisexuality. My problem was the relationship. So being, going back to what I was saying, those structural, that systematic oppression of LGBT people, where we have been seen as problematic, that our sexuality is problematic, that our gender identity is problematic, is threatening somehow, that people need to be reassured that that isn't going to happen, that the problem will be identified as what is being presented, and people's identities of sexuality and gender will be respected. So I think you can put on your website that this means LGBT people, but I think you need to do more than that. I think you need to show, you need to say, we have had training, we have done this, we have visited, that we are in partnership with a local LGBT organization. Um, we are working with, we support Pride, we have a presence in LGBT spaces when issues come up. It's about showing involvement and commitment in the long term, not as a one-off, or we did Pride this year, but as an ongoing commitment to support and engage with and listen to local LGBT people. That requires work, and it's difficult because it's hard to get that kind of funding to do that kind of outreach and community engagement. But I do think that works when it's done. So a local project in the northeast here, were able to get some funding for an LGBT. Um, it was a rape crisis, so it was a sexual violence advisor, ISVAs as they're called here, independent sexual violence advisor, and they just saw their numbers go up, but then they lost the funding. So we're yet to know whether, because they were able to bring LGBT people in, whether that has been sustained over time, or whether you lose that sense of connection because you've no longer got a visible specialist worker. Having visible LGBT people who are prepared to be identified as a lead on these things on websites or in literature, or go out and do visits or go out and speak, that can be really useful. But again, that relies on LGBT practitioners to be willing to do that and to become the kind of lead person. But looking at employment, who is being employed, and again, you would say this around any intersecting identities, wouldn't you? You'd be saying, if we're serving everybody in the community, have we got racially minoritized communities represented in our staffing? Have we got LGBT people represented in our staffing? But understanding that people who are LGBT don't necessarily want to be the lead. So then you've got to think about, well, what else do you do? How do you have a visible connection and visible evidence of your commitment to local LGBT communities? And doing it in a planned way, having a kind of a plan for how you might do that is really useful. And understanding that it has to be sustained is really important. It isn't something that can be done over the Pride month of June, or Idaho Day. These are important dates when it's an opportunity, but that can't be the only thing that is done.
Absolutely. With that, I would like to maybe request you to shed some support as to how can, over the long run, programs maintain a continuous evolution while addressing the changing needs of LGBT plus individuals, and with like the kind of guidelines, very clear guidelines that you have just given at the initial stages. When we are talking of the long run, what sort of metrics and indicators would you suggest to evaluate the success of an LGBT plus inclusive perpetrator program?
Ooh, that's a lot in there, isn't it? I mean, I think we're, I think it's quite difficult to talk about a perpetrator program at the moment, like a group program. I think we're probably talking about individual one-to-one work, because that the other problem that we have is that LGBT people, we use that umbrella acronym, and I know it's getting bigger, and I've kind of stayed at LGBTQ plus, but people are, you know, it's getting bigger and bigger to try to be as inclusive as possible. And the message really is that this is not a homogenous group. This is a hugely diverse and evolving group of people who are grouped together because they do not conform to cis heteronormative norms of sexuality and gender. That's it. Other than that, they might not have very much else in common. And they might have, you know, there will be racism in LGBT communities. There will be ableism. There will be ageism. So LGBT communities are not necessarily a haven for anybody who is LGBT plus. Um, so understanding that will help in realizing that if you're going to have a program or an intervention that addresses people who are abusive, that you have to remain open to understanding that people are different, um, and that they have very different ways and increasingly different ways of identifying their I themselves in terms of their sexuality or their gender identity, as well as their other intersecting identities. So I suppose the learning is never over, and realizing that is quite liberating because you're always learning, um, and you keep the conversation going, and having LGBT people involved in the oversight or the delivery of those interventions helps that, because it keeps you in contact with and in touch with what might be happening. And there are different things that characterize, um, you know, LGBT people. The You know, like that bisexual woman I referred to earlier, she was living in quite a rural community, and kind of went into the friendship network of her abusive partner, all of whom were lesbians, all had a very specific definition of lesbian that was about never having slept with men, and were also very much into butch femme ways of running your relationship. Well, you know, 20 miles away in a city, it'll be probably very different. Um, Norms. Similarly, with gay men, we know that there are places in England, and I'm sure you'll know this in your own countries, where chemsex is a huge issue, chemsex parties for gay and bisexual men, and in other parts of the country, that is not necessarily available as an option, or people might have to travel if they want to get involved with those things. So what's going on locally is, what kind of norms of being, are very important as well to understanding what is useful in an intervention in this location, geographically, within these communities, and never talking about the LGBT community. It isn't one community. It is made up of lots of different communities, or friendship networks or affinity networks through, the gay outdoors society where they meet up and go for walks, or the, you know, elderly dykes walking group, or they're affinity groups. They're not, you can feel like you belong, and that's important if you're pretty isolated in where you live, but they're not all the same. They are full of diversity of needs and wants and identities. So being open to that is part of what is needed to evolve successfully. And then your metrics, so your indicators. I mean, we've been talking about this to do with this project that we're setting up. What I think partly, I don't know if people are aware of the Mirabelle project, which was a big project that looked at evaluated heterosexual men's perpetrator programs. And I think what they did initially was really interesting, and I think this could be very useful, is they interviewed all the stakeholders involved in the voluntary perpetrator program setup. So victim survivors, abusive men, the deliverers, the funders, and they asked them what they thought success meant for the program. And I think that is a really, really interesting thing to do, to understand that people look at success in very different ways. And I think starting with that for this kind of work could be really useful for LGBT people. What do people want? What do people hope will happen as a result of this? What would success look like if somebody is taking part in this program, and get that from the different stakeholders at the beginning, and then start to develop your indicators of success from that, because that is much more that intervention specific. And some of those indicators, I'm sure, will be known and used in other evaluations, but it's kind of grounded in that particular intervention, which I think makes it more meaningful if people have a sense of what are they trying to do with this program, what are they hoping to achieve with this kind of intervention being run in this location for this amount of time with this group of people or these individuals. Um, because I kind of feel that it's entirely possible with our project, or I say our project, the project I'm lucky to be on the steering group of, is uh, what I'm looking for is that engagement at the beginning. It's entirely possible with the length of time we've got on the project that we'll see very few LGBT people going through the intervention. But if we can get that engagement right, then that will be really good learning for us about how do we get LGBT people who have abused into voluntary interventions.
Thank you for that, Catherine. And we have touched upon some really important aspects of intersectionality, acknowledgement of the pluralism of the community in itself, and customizing your approach to your own geographical as well as social economic needs whenever we are designing and trying to refine our programs to cater to this community. We are on the last leg of our conversation and we are spilling over. So I would now ask you my final question. Could you share any insights or advice for practitioners who might be hesitant or unsure about engaging with the LGBT plus domestic abuse cases? I guess that's an interesting one.
No, but you know what? Kind of think there is some learning to do, but you already know lots of the principles from the work that you do in kind of mainstream domestic abuse field. You know that this is about power and control and the abuse of power. You know that people use whatever works, and that can be physical, sexual, economic, coercive control. abusive behaviors, I suppose the thing I would suggest is to think about the relationship rules rather than heteronormativity, because I think if you think about heteronormativity when you're thinking about LGBT people, you get into the public story, and I think that gets in the way of thinking about power and thinking about the relationship rules. I think the relationship rules can be useful way of understanding how power is operating, who's making all the key decisions, who's taking responsibility for everything. And as a consequence, and we haven't even touched on this, which we should have, is because survivors that we spoke to, whatever their sexuality or gender was, very, very often feel sorry for the abusive partner, can explain why they behave they do, and want to help them, want to protect them, and want to see if they can support them. That might change over time as a result of what happens in the relationship, but that is what people said to us. Love and care is hugely important in understanding how these relationships are maintained and sustained and returned to. So understanding who takes responsibility because they care about the abusive partner is really useful in approaching people in LGBTQ plus relationships. I'm going to stop because I realise that we are running out of time, but thank you for letting me go over time there for a minute.
No worries at all. Yes, we are. We have already spilled over, but I would still like to take 5 minutes and request the attendees to put forward their questions if they have. You can use the chat box or could also raise your hand.
Oh, yeah. Question's good.
But still, since we are short of time, we would also feel free to send them to me later on afterwards via your emails as well. But we would wait for 5 minutes and see if there are some questions right away.
There seems to be a question in the chat. Maybe Rasha, you can quickly pop in there.
Yes, thank you, Lily. Nick asks, are the relationship rules primarily for LGBT or all violent relationships? This is a question from Sarah.
Well, we argued that it was for all because it came from the research we did comparing love and violence in same-sex and heterosexual relationships. So we suggest that it does operate across all abusive relationships.
Thank you, Sarah. Do we have any more questions? You can always feel free to unmute yourself and ask directly.
I mean, there's a comment from Nick, isn't there, about why things go wrong in family courts. Survivors being willing to speak up and protect them. Yeah. I think it's very abusive partners are very willing to apologize and explain why they do what they do in a context of a loving relationship. But we've got to remember these relationships are entered into consensually, unless we're talking about forced marriage, which we're not. So they're entered into consensually with feelings of love or care, desire, hope for a future. And that can really be manipulated again by abusive partners. If you loved me, you wouldn't report me, you wouldn't leave me. I'll kill myself. There won't be anybody else for me once you're gone. I didn't mean it. I had a terrible childhood. I've got substance use problems. That they're very powerful and elicit feelings of care from survivors.
we have one more question from
Women
Sarah.
abusers. Sorry, women abusers of IPV. I'm not sure what that's. Oh, women abused of IPV are often afraid of being killed. Is it the same in same-sex relationships? This is a really interesting one, Sarah, because there's some research just coming out. I don't know if it's been published yet in New York, where they did. I'm not going to be able. I'm not going to do it. It's right, but where they looked at the impacts of abuse across sexualities, and what they found that people in LGBTQ relationships didn't record or report fear in the same way that heterosexual women did. So that's quite an interesting difference. We didn't look at that, so I can't comment on it from our own research, but it certainly has made us think about what has happened, what does that mean, and what happens there, because you can certainly see one of the things that we got as a theme running through how survivors talk to us who are LGBT plus was a kind of annihilation of self, that they didn't know who they were anymore, that they lost their sense of self. So there was that kind of impact or outcome. But yeah, no, you ask a really interesting question. And of course, LGBT people do get murdered by abusive partners. And there's some James Rowlands, if you're interested, he's also now just moved to Durham, where I am, Durham University. He's written about LGBT domestic homicide reviews. We don't have very many of them in Britain. Well, in Scotland, they're only just now setting up homicide reviews. But part of the problem is that very often they're not identified as being LGBT, so they're not identified as being an LGBT homicide case review. But in America, there's evidence that murder or homicide is very common in domestically abusive relationships in LGBT communities. So yeah, it's an interesting question you pose, and I'm not quite sure where we need more research on it.
Right. Unless we have any more questions, yes. Sarah wants to know if she can reach out to you, Catherine. If she
Oh
cannot
yeah,
find you.
absolutely, no problem. Please do. Anybody can reach out to me if you think if I can be useful.
Yeah. Thank you, Catherine. I think, yes, if any more further questions arise, please feel free to reach out to me and Catherine. And we would be, of course, sharing the recording of the webinar on our channels with everyone once they're ready. And yes, we will be keeping the conversation ongoing in the future as well. Thank you, everyone, for attending this webinar. And thank you, Catherine, for joining me.
Oh, absolute pleasure.
Very
Thank you very
special
much,
event.
everybody.